everyone. Thank you, Gov. It's great to be here. So just wanted to give some basic updates today, and you're going to hear more details about many of these things from Dr. Anderson, our Director of Health. So first of all, as Governor said, you are doing a great job, an absolutely great job. It is phenomenal what's being accomplished. Today, 4 new cases, okay? 4 new cases of COVID-19 confirmed in the state of Hawaii today for a total of 584. And the big news is that we've had 0 cases on Oahu today, which is something actually to be astounded by. And that really is testament to your efforts and to the governor's order of about a month ago to not have travelers come into the state of Hawaii. So 2 new cases are from Maui. 2 new cases are on Big Island, no new cases on Oahu or Kauai, Molokai or Lanai. So your efforts are paying off, and I know that your sacrifice is immense, so it's good to see a payoff from sacrifice. Also, we're holding steadily at 15% ventilators. Latest number, 68 out of 459 of our ventilators are in use. That's 15%, like I said. That's very important because we know that this is the life-sustaining support that we would often need if one of our kupuna or others became sick, or anyone for that matter, and needed a ventilator for respiratory assistance. Very important. Other states have obviously overwhelmed their ventilators because they saw a very large increase in the number of cases before they could handle them. My heart goes out with the Gov to the loved ones of the 10th individual that passed away. That was a traveler to our state, but we feel heartsick when anyone dies here in our islands. And it is clear that we expected people to pass away from this disease. We were prepared that it might occur. This is the number, okay, so 10 deaths, as you know, which is the lowest, or rather the second lowest mortality rate in the United States. Our mortality rate is 0.7%. The only state that has a lower mortality rate is the state of Wyoming. And the state of Wyoming, as you know, or can imagine, is very, very sparsely populated. They can't even compare to us. In some ways, it's apples and oranges, as I'm sure others will point out. Any state that has a city like we do with Honolulu and does not have a large mortality rate is really doing something special. So that's a testament to our first responders, to our nurses, our docs, to our firefighters and police officers. Very incredible. You also have often asked how many people we're testing. Are we doing enough testing? So the test number we have now is 24,543 individuals have been tested. We've actually run a few more tests, so please don't be confused by that. Some people have been tested twice for certain circumstances. 584 positive tests, as I reported earlier, and that's just 2.37%. That's a very low percentage as compared to other states across the country. The reason for that is some states have only tested in the acute hospital setting, and obviously those individuals are very sick, and the likelihood of testing positive is much higher. So that's important news, and I know people want to know, are people getting better? Of the 584, we've discussed how many people passed away. The recovery rate is significant. 423 individuals have actually now recovered, and that's a 72.4% recovery rate. So it's a trend we want to have. We want to see this number obviously go all the way up to as close to 100% as we can get. And that will tell us then that we don't have active virus in our community to the best of our knowledge. So I've been receiving briefings from our healthcare team as a part of the State Operations Center, and I'm going to give some information that I don't think people have discussed much before. So we've done some very good modeling. Bruce's team, the State Emergency Operating Center, there's some terrific young people there that are working with Department of Health. And had we not had the governor's order and stopped travel here and allowed spread throughout the islands, the number would have been much worse, you're all aware. Their model showed this number. 4,479 people. That's the number of individuals that would have passed away, that would have died in the state of Hawaii based on that model, had we not taken the advice of the Gov, had we not made these sacrifices that you're making at home. Instead, 10 people have died. This number would have been catastrophic. This is what would have happened if we had had a surge, and it probably would have surged to a peak sometime last week. Now, we're not out of the woods yet. There's obvious concerns still, and we have a lot of planning to do with Alan and others, but you've done something extraordinary, and that's why I wanted to share that with you. Just the last couple points. Some people have been asking about masks for all people. Well, there is a circumstance, this is me putting my physician hat on, there is a circumstance when people can't wear a mask. If they have chronic lung disease, COPD, or severe asthma as young children, in some cases, the CDC has not recommended that people wear masks because it could do them more harm than good. We still recommend people socially distance completely, but please be careful about criticizing others in communities. If you're at the store, if they happen to already have trouble breathing and are not wearing a mask, it may not be as simple as you think. They may have underlying lung disease, and that's why they can't wear a mask. Finally, I know everybody wants to get back to normal. The Gov, we all want you to get back to normal. That's why we're so impressed by your commitment to staying at home and avoiding a catastrophic surge in our state. Just please know that COVID-19 is bound to be a part of our lives for some time, but that doesn't mean we're not diligently working to ensure a return to normal and opening up Hawaii. That's what you're going to hear from Alan, some of the early plans. Obviously, the Gov's keeping you up to date very often. So please don't lose hope, don't lose faith. Know that you've done something quite extraordinary. Aloha.